Good morning, everyone, and thank you for joining me for today's Beyond an Apple a Day, providing consumer health information at your library. My name is Sarah Miles. I'm the Health Professions Coordinator for the National Network of Libraries of Medicine South Central Region, and I'm so pleased that all of you could join me today. The first thing I want to do is go over a little bit of what the NNLM is, the National Network of Libraries of Medicine. Many of you should be familiar with this as you have accounts on our website in order to register for this class. But just as a reminder, our mission is to advance the progress of medicine and improve public health by providing all health professionals with equal access to biomedical information, as well as improving the public's access to information, enabling them to make informed health decisions. Today's session will really be focusing on that second part, helping improve the public's access to health information, both at public libraries, but as well as other institutions. Our mission means that we really work with any organization that is working with health information, which, as you can imagine, means we have a very broad target audience. So hopefully many of you today represent some of those various groups that we are trying to work with. Our program is organized by the National Library of Medicine, the largest biomedical library in the world, and it's carried out through a nationwide network. This is what our structure actually looks like. The National Institutes of Health is, of course, the U.S.'s medical research agency comprised of 27 institutes and centers. The National Library of Medicine is one of those 27 institutes and centers. And then the network, it comprised of 8 regional medical libraries, 8 offices around the country, as well as 5 support offices that carry out that mission. Each of the regional medical libraries is housed at a university health science library, and if you aren't already familiar, you can find out more about where your NNLM regional office is located on our website. This is just a little map to give you sort of an idea. Here in the South Central region, we are physically located in Fort Worth, Texas, and we serve the states of Texas, Louisiana, Arkansas, Oklahoma, and New Mexico. There are 7 other offices around the country, and you are welcome to look at our website, which is nnlm.gov, for more information about who is your office. Now to today's agenda. This is the content we'll actually be covering in today's 2-hour session. We're going to be looking at consumer health, its history and evolution, and why it's so important, particularly for public libraries and other public-facing institutions, to be familiar with authoritative health information resources. We'll look at some of the challenges providing consumer health information at your library or institution. We'll look at the reference interviews, some of the ethics involved when we're answering these health questions, how you might go about planning a consumer health service to let your users know about where they can find health information online as well as in person. We'll talk a little bit about collection development, and then look at some of the free resources that are available from the National Library of Medicine, as well as some other resources as well. Finally, we'll wrap up today's session talking about outreach, who are some possible partners for collaboration, as well as how you might go about developing a project and marketing your services to your users. We will take a break about midway through the session for anyone who needs to run to the quick bathroom break, check some emails, whatever, during the middle of the session. So we will have a quick break somewhere in the middle there. So the first thing I want to talk about is the consumer health and health literacy. Before I do this, let's go ahead and have a quick chat question for you all. If you all would go ahead and write in your chat box and send to everyone what institution you are at. So if you're a public library, public health department, a university library, go ahead and write that in the chat box just so I can get an idea of what kind of span we have today. All right, I saw community college, quite a few public libraries. Ooh, hospital, excellent. Several hospital libraries. Number of university libraries. Very nice. All right. Talking book program. Oh, yes, I've heard of that one. Excellent. Wonderful. Okay, so thank you for all of you who've entered that in. You can go ahead and continuing enter those. I'll watch them as they scroll through the chat. So it looks like we do have a good variety of librarians and people representing libraries here today, which is great information. So this session is designed with the public libraries in mind. Of course, it's applicable to any library, and really we want to encourage any institution to be thinking about this information. Great. So first things first, let's talk about a little bit about consumer health then and now. So I have this date on here, 1972, and that's really where I want to start our discussion, or what we're thinking about the history of consumer health. 1972 is when they first came out with the Patient Bill of Rights. This is describing what rights individuals have when they are patients in a healthcare facility. It includes the right to information, the right to fair treatment, and the right to autonomy to make decisions about their own treatment. Now, what this means, as a consequence, the realities of healthcare today, almost 50 years after that Patient Bill of Rights, is that patients are asked to make decisions about their own disease process, but of course, most patients do not have the tools or knowledge to make those fully informed decisions, and so we have a problem with very low health literacy. And of course, that last point there, I really want to emphasize libraries, and I would add a caveat, all health information organizations can help with this problem. We can help these patients get the information that they need to be making these decisions to retain their autonomy about the decisions regarding their own health care. Now, a quick caveat, I do want to remind people that this Bill of Rights is in the United States. This is not universal. Other countries would not necessarily have a similar Bill of Rights for patients. So especially if you're dealing with immigrants in your libraries, this is something to keep in mind. This is something they might not be as familiar with. All right, great. We have a comment there. Even we as librarians don't know how we would handle our own patient. Great, thank you for that. So with librarian skills, we can help the public with this problem. So now I want to talk a little bit about the evolution of e-patients, which is something we can call the patients using online health information. Certainly 1972 was quite a few years ago, and since then the internet has really taken over as the source for all information, especially health information for patients. So my dates here are a little bit older, but really looking at the change over time. In 2000, 52 million Americans were searching online for health information. Just 2 years later, that number had increased by 50%. More than that, 2006, we see that 80% of Americans are using the internet. That was over 10 years ago. I'm sure the number is higher now for the percentage of Americans that are using the internet. All of these statistics were pulled from various Pew Internet Research studies. That's where these statistics are coming from. I want to note in 2006, it is over 10 years old, but I would imagine that unfortunately this statistic probably has not changed, and that's that only 25% of people who use the internet for health information say that they usually or always check the source and date of that information. So maybe it has increased slightly, but I'm sure it's still a low percentage, and that's really where I think libraries can come in and help with that. 2013 is a little bit more recent, and in that year, 59% of adults looked specifically for health information online. A lot of them are using the internet to figure out what they have. We call these online diagnosers, and only half of those people talked to a clinician about the information. So this is your average Joe on the street, either Googling or using WebMD or a similar resource saying, these are my symptoms, what do I have? And as we all know, 50% of the time, they're told they have cancer, whether or not that's accurate. So this Googling for a diagnosis is really an issue that I think librarians in particular can really have an impact on with really good programming and instruction to your users about what's the best place to find authoritative health information, and also how do we evaluate that online health information. Another statistic that's a little bit more recent, it's from, I believe it's also from the 2013 study, that 1 in 20 of the searches that are performed on Google are for health information. That's actually more recent, I remember now. In 2015, Google started making more robust health information part of their search engine, so that statistic is from around 2016. 1 in 20 searches. So a lot of the information that's being looked for online is health-related. So here's another quick question I want to throw out to you all in the audience. How would you define literacy in general? Certainly literacy is something that libraries are especially concerned with, but just throw it there in the chat box. What's something you could define? Short and sweet definition of literacy. Give everyone a couple minutes to type. All right, here we go. Here's some answers. Read, understand, apply. Ooh, I like that. 3 words, short and sweet. The ability to understand and evaluate information. Reading, right, having enough information. Great. All right, well, generally, usually literacy, we connect very, very strongly with reading, right, the ability to read, and then that second step of understand what they're reading. All right, I like that. We also talking about the ability to find and use information correctly. So this is going on beyond just reading and understanding, but knowing how to find information in addition to reading it and understanding it. Very nice. Well, then if we apply this then to health literacy, I think some of the definitions you all gave me would be very easily converted. We're going to use this concept talking about health. It's the ability to find and use health information in the correct manner, which, as we know, because health is usually a much more difficult concept to understand. It's a little bit higher level, so we can imagine that health literacy is going to have a little bit higher barrier for people. So here are just a couple definitions. You'll find others available out there online, but these 2 generally the main ones that people go by. So that first one reads almost word for word like some of y'all's things that you put in the chat. So health literacy, the ability to read, understand, and act on health information. The read, understand, apply here, but specifically for health information. The second definition is from Healthy People 2010 and 2020. So if you're not familiar, this is a document put out every year by the U.S. government about public health and what are the health measures that are goals for the public health departments around the country to be working on. So Healthy People 2020, I believe, is the current one. It's about to end, and I imagine Health 2030 will be coming out soon. But their definition, very similar, the degree to which individuals have the capacity to obtain, that's that find, process, and understand the basic health information and services needed to make appropriate health decisions. So with that autonomy given by the Patient Bill of Rights, health literacy is going to be really key to helping people make their own decisions about health. So I may have revealed my hand here. This is a quick question for you guys. What do you think is the strongest predictor of an individual's health status? Would it be age, income, employment status, education, literacy skills, racial or ethnic group? Throw in there in the chat box what you think is the strongest predictor. That's true. Insurance companies do look at age, education. Great. Right. Certainly all of these are factors. Certainly income and the income gap is something that is going to affect the health status. You are right, Jessica. It really is all of these are predictors. But the strongest predictor, they're kind of related to education piece, but really the literacy skills. The health literacy is a huge factor. It's the strongest predictor of an individual's health status. So really that literacy level, it's something that libraries do already. So figuring out how we can extend that and apply it to health literacy skills as well is really going to have a great impact on our users. So another quick poll for you all, some more statistics. I love numbers, math, what used to be one of my fortes, but here's some more numbers for you. You guys can go ahead and guess. The first one is 1 out of how many American adults reads at the 5th grade level or lower? So shoot that in the chat box, 1 out of how many, what do you think is the percent there? And the second one is Americans, excuse me for the typo there, Americans read at the 8th to 9th grade level, yet most healthcare materials are written above the what grade level? So go ahead and give me the grade level as well. Okay. So it looks like for our first question, we had 1 in 5, 1 in 4, 1 in 6, 1 in 10, mostly lower numbers, and I get a lot of 10th and 12th grade for the second question. Very good. All right. So it is 1 out of 5. So 20% of Americans read at the 5th grade level or lower. The average reading level is 8th to 9th grade, but a good 20% of the population is lower than that 5th grade reading level. And it is 10th grade that most healthcare materials are written above 10th grade level. There are quite a few above the 12th grade level, but most of them are written 10th or higher. So really a gap here in the literacy. We have the average Americans reading 8th to 9th, 20% reading at 5th or lower, and yet all of the healthcare materials are written at a much higher level. So this is an issue about easy-to-read materials just not being available for people who need them. We've really talked about this, why health literacy is so critical. It is an essential life skill. It's going to be giving these patients the ability to make those decisions about their own health care. It's a public health imperative. I mentioned the Healthy People 2010 and 2020. Health literacy has been included as a goal in both of those documents, and I imagine will continue to be included in the future public health imperatives. It is really part of our social capital. Someone mentioned insurance companies earlier and the healthcare industry. As these industries are changing over time, both with the increase of technology and the internet, health literacy is just going to become more and more essential for people to be able to find information and understand that information that they need. And it does affect the economy. We've talked about income and healthcare, the healthcare industry, and how it affects income is certainly something that is unfortunately trending in an unfortunate way. So these are really important things to remember when we're thinking about health literacy, thinking about how we might make an impact on the health literacy of our users. So I wanted to mention a couple of quick resources here. I will have some more in-depth look at some websites and resources later, but specifically these are resources for health literacy. They're for those easy-to-read materials. So as we've just learned, most health information materials are written at 10th grade level or higher. These two resources, there are others, but these two I wanted to highlight, are going to be access to some of those easier-to-read materials. Medline Plus is a website we'll be looking at more in depth later in today's class, but they specifically have a section on easy-to-read resources. The entire website as a whole has been written at a lower literacy level. I don't remember off the top of my head what it is, but I believe it's lower than the average of 9th or 10th grade. I think many of the resources are written at that 5th grade reading level. So the website as a whole is really an easy-to-read resource, but they have a specific page on those easy-to-read resources and also how to write an easy-to-read page. There are a lot of online resources that exist now where if you have something you're writing, a flyer, a pamphlet that you want to be releasing to your users, you can copy and paste the words and measure the literacy level of that document. So I believe some of those resources are linked on that Medline Plus Easy to Read page. I really encourage you, if you are creating materials, to be using those online literacy tools to really help you and guide you as you're writing those materials. The second resource there is called the Ask Me 3 program. It's a partnership for clear health communication. This is something that was developed several years ago, but they came up with these 3 questions, which I think is a really great example of an easy to remember, easy to understand 3-step question for people to use when they're meeting with their doctor or with their healthcare provider. And those 3 questions, you can see them there on the screen. It's what is my main problem, what do I need to do, and why is it important for me to do this? So when someone is in the doctor's office getting a diagnosis, getting health information from their doctor, this is a really easy 3-step method. They can have it written down on a piece of paper before they go. Ask, what is the problem? Tell me in simple terms, what do I need to do about this problem? Do I need to take a pill, get a prescription? Do I need to follow up? Do I need to change something in my lifestyle? what is it that that person needs to go home and do, and also why is it important, that imperative. If you don't do this, this could be the consequences, really, that motivation for doing the number 2. So I really like this 3-step method. This is one thing that can be used. There are, of course, many, many other resources out there. As our office, we actually have Health Literacy Awards grant funding that is available, and we have one Center for Health Literacy that was involved in creating these resources. So they exist. There are institutions working on creating more easy-to-read health materials online. They are available for you if you can find them on the websites. Some of these websites will have links. Medline Plus will have links to other resources as well. So keep these in mind for when you're writing any materials or you're looking for some of that easier-to-read materials online. All right, so I want to transition and talk a little bit more. Now we've got our imperative for why this is so important. Let's move to what we can do about it. So the first, of course, in a library, that reference interview is going to be the first level, and then a second level is looking at planning a service, so how you all can be using those tools to help your users. First, I want to send this out to all of you. When you have a health information question, someone comes up to you in your library and asks you a health information question, what are some unique challenges to that interaction when someone asks you a health question? Go ahead and stick in your chat box some of the challenges you can think of. They can be general challenges that would affect any health information or any reference interview, but I'm specifically thinking about health information. What are some extra caveats, extra things you need to be thinking about for health questions in the library? Give everyone a few minutes to think and start typing. So we can think of a specific situation. Someone comes up, someone earlier had the cancer patient issue. So a cancer patient comes up to you and says, I just got this diagnosis. I'm looking for information about cancer. What are going to be some things we need to think about in that situation? Oh, I am not scrolling. That's why I'm not seeing any. All right. Apologies. Let's see. Unlicensed practice of medicine. HIPAA. Yes. Patient privacy. Patron embarrassment. Getting the person to be specific. Language. The reason why they're asking. Vocabulary. Excellent. Oh, wonderful. Great. Wonderful. Lots and lots of suggestions here. Maybe incorrect memory. They wrote it down and thinks it's something but didn't write it down correctly. All right. Emotion. Yes. All right. So we've hit on a lot of these that you guys have written in the chat box. They're not familiar with the medical terminology. This is a huge issue. This is part of the reason health literacy is so much harder than just regular literacy, some of that medical terminology. Knowing how much we can ask them in our reference interview to help guide what information they're looking for. There is privacy issues. What can we ask? What can we not ask? Personal experience is a huge one. Someone mentioned unlicensed medical advice. This is something we need to remember. I knew someone once who had this thing and that helped them. That's not the kind of thing we want to be giving them. And not being familiar with the resources. I know in the past I also had worked at a public library, and when I would get these questions, I would say, let me grab someone else for you. I didn't want to be the person to answer these because I wasn't sure what the resources were or where to direct them to. So hopefully after today, you'll be a little bit more familiar with some of the resources you can use here. But these are all things we need to be thinking about when someone asks us that health question. So in that context, when someone asks you a specific question about health information, these are just some tips and tools to really be empathetic. Someone mentioned their emotional state. Usually health is something that is emotional. It can be, I just got told I have this terrible disease, or a family member has this terrible disease. It can be something that's very, very upsetting. So being empathetic, being an active listener, I really want to highlight that using the open-ended questions, certainly we don't want to be judgmental. We also don't want to guide them and ask too specific information. This is especially important when we're thinking about mental health as well, which might be something that you're asked, particularly in a public library where we have a number of the homeless and other really affected populations for mental health questions. Not being judgmental is something to keep in mind. We have that privacy, confidentiality, the emotions there. Oh, I see, yes, someone whose sister just died. It was a really hard interview. Okay. The social worker is a great resource. I know there's a number of public librarians now who are public libraries moving to have a social worker in the library on site. There's a number of webinars online about how you can set this up. Certainly it does help for that sort of situation where you have a difficult patron, a difficult interaction, you can have someone there to help. But sometimes it's just going to be you. And so knowing, being prepared for those emotions, knowing your limits, and also knowing the limits of your collection, what limits of access to information, being aware of what you can give them and what you can't give them is really important. And also, again, don't be afraid to refer the patron back to their healthcare provider. This is a really key thing, is that disclaimer. We are librarians, a lot of us on the call. We are not the official health professionals, so this is really important. If you don't have one of these disclaimers, if it's not something you've talked about at your library and institution, you may want to talk to your manager, or if you are a manager, think about having one of these disclaimers in your employee handbook so that people know to tell patrons, look, I'm going to help you find some authoritative health resources, but please remember, these are not official health professionals. We encourage you to seek medical advice from a health professional. Do not just rely on the information and resources from the library. And that's a good segue. You can say, and if you need help finding a health professional, let me help you do that. So that is another way we can provide information, is directing them to someone. Particularly those who don't have health insurance, this is going to be an issue. There are some resources, again, on Medline Plus and online on how to connect people of low income and without insurance to health providers. So remember these caution statements, keep these in mind when you are asked a health question. Always suggest to follow up with their primary care physician. Excellent, yes. And think about having one of these either on file or posted somewhere in your library if this is something your staff is experiencing a lot. This will really help in keeping them, assuring them they can still answer. They can help people looking for health information, but they must have this disclaimer when they do it. Instead of just saying, oh, no, we don't do any medical information, and saying, go look somewhere else. You can help the person find the resources, but make sure you also tell them, follow up with a health professional. Again, some of the ethical guidelines, many of you have mentioned this already, but some of the things to really keep in mind, that privacy and confidentiality. If it is an issue of a really upset patron, if you have a private space, you could move the reference interview into a separate space. That might be helpful. Again, know the limits of your own collection and what you and what they can access, particularly for anyone who's working in an academic or university library. If your university is open to the public, can they access some of the resources on your computers in your library, or are your libraries restricted? Are they going to be able to find that information? So this is really key to know what type of user it is and what kind of access they're going to have. That will really help guide you in what resources you're going to lead them to. Again, just a reminder, it is not our job to interpret medical information. So that's why we have those disclaimers and caution statements. Make sure that you're reminding patrons of those as well. So moving on, we've had the questions. This is what to do. I think probably the reference interview is going to be the main way that public libraries in particular are dealing with health questions. But if you see a need, if you're interested in doing a consumer health service, and we're planning the service, what's the first step? What do you all think is the first thing we need if we're thinking about doing a consumer health service in our library? We want to do something health related. Where would you start? go ahead and throw in the chat box. What's the first step that you all might take? All right, I see a survey as a possible first step. What are some others? Brainstorming. All right, stats for health issues in the county. All right, maybe funding. Money is always an issue, we know. Okay, maybe looking at your staff. What are your resources to be able to do that? Looking at your collection. Excellent. Great. Ooh, reaching out. I love that. Partnering is always great, particularly for health programming. All right, so these are some really great ideas, coming more familiar with resources, what is available, putting together that team, partnering. These are all really, really wonderful. I love the partnering idea, and I really like talking to your staff. Maybe it's something that they would be interested in. But one thing you can be doing first is that needs assessment. This is something a lot of you have come up with already. A survey is one way to do it, but this is something you can do by yourself before you reach out to anyone, before you talk to anyone. You can be looking at what are the needs of your community. And I've included just a couple of resources here that you can look at to find out some of the health statistics in your community. That first one, Agency for Healthcare Research and Quality, AHRQ, is one really great resource for looking up data for the needs of different communities. Some of these other ones, Leapfrog, Health Grades, these are things where you can be looking up. I think Health Grades is specifically grades of hospitals. Of course, remember to take those with a grain of salt, but they can be looking at different hospitals and different areas. What are the grades of different health measures in your community? The Joint Commission is another resource. Also, something that not everyone knows is I believe it's all hospitals are now required to be doing community needs assessments on a regular basis. I think it's something like a 3-year cycle. So in many cases, you can reach out to your local hospital. If there's a hospital libraries love partnering with the local public libraries. So reach out to your hospital library, and get that needs assessment. It is available for anyone to have access to, and thank you for confirming it is every 3 years they're doing this. So that work may have already been done for your community. You can ask to see that and be looking at what are the specific health issues that are facing your community. You can be looking for something called diagnostic-related groups. What are the different types of diagnoses that are really affecting the population in your community? Oh, great. A lot of these needs assessments are posted online, but if they aren't online, or if you're having trouble navigating the hospital website, it is something you can reach out and talk to someone about. Particularly if there's a hospital library, don't forget about your hospital libraries. They're a great resource for you. And be looking at these needs assessments, because what this information is going to give you is what is there a need for. If you're going to find out that there's a large number of cancer diagnosis in your community, doing a cancer program, it might be something that would really be popular or have a lot of people interested in finding out more information. It's going to be a need there for information, for health information. So using this as a first step, really thinking about what are the needs of your community, what needs can you be filling with your service is a great first step. You can also be looking at the demographics of your community. Certainly the demographics of your patrons are going to be important for when you think about a health service. But if you are looking to reach maybe some people who aren't coming into the library for this information, you can be looking at the demographics of your community. So CDC has a, I think it's supposed to stand for FAST Stats. That's FAST-Stats. They put it together in one word. The CDC has great statistics there. Kaiser State Health Facts have ones on the specific state level, and I believe it does go down to the community level. That Hospital Compare is going to give you hospital-specific statistics, and I included the Census Bureau. I actually recently attended a session by the Census Bureau. This is a free resource. All of these are free, but the Census Bureau is giving you access to census information, and it is available not only on the county level, but it drills down even to the level of blocks, city blocks. You can find information that specific using the Census Bureau information finder. And we're actually planning on having a session later this year about how to use the Census Bureau Information Finder, so be on the lookout for that. I see a question here in the chat box. Does hospital compare talk about context? You know, Nicolette, I am not sure. That's a good question. I'll go ahead and write that question down, and if you want to follow up with me later on that question, you can find my information at the end of the session. I'm not sure about that. If anyone in the chat box knows a little bit more about hospital compare, please feel free to chime in. But these are, yes, of course, all of the data is going to be a little bit, you know, don't just take it at face value. You're going to have to know a little bit about context, absolutely. You can also be looking at, there are online resources telling you, rating each of the states on different types of health issues. What are the health issues really affecting your community? I know here in the South Central region, we unfortunately have a lot of issues, particularly with obesity and diabetes. So that's the one example of I believe Louisiana and Oklahoma, probably Arkansas, New Mexico, and Texas as well are ranked fairly low on that obesity and diabetes issue. Great, we have medical librarians, hospital librarians wanting more. If you want help finding this information, there are hospital librarians. So Judy is a medical librarian in a hospital and a public library setting. Great, there's a lot of consumer health requests at their public library. Judy has put her email there in the chat box for anyone who'd like to reach out. Wonderful, thank you so much. I love making connections and partnerships happen in my webinar. This is great. All right, but moving on from demographics. So you find your needs assessment, you're finding the demographics of your community, and then you're going to think about the consumer health service. So we've already answered this question. You all have already pointed out some great issues. The resource question, of course, money, time, and staff is going to be some of the most important considerations you really have to think about when you're thinking about the service at your institution. So next, let's think about the collection. Collection development has come up a number of times. If you are in a public library in particular and you're looking for ways to improve your health information collection, there are book lists available from institutions. Certainly the Medical Library Association has a special interest group or a section that's looking at consumer health information collections, and they have, I believe, a book list published online, or you can contact someone from that group to get a list of recommended titles for consumer health information for your library. Certainly reach out to health science libraries in your community, whether they're hospital libraries or the university health science libraries. They can really be a good guide for what you would need to have in your library, or maybe finding out you don't need it in your library, you can send your patrons to that health science library, find out where you all can collaborate, and certainly other libraries can be a good resource for this. Yeah, Sydney, I was looking at that as well. The consumer information list hasn't really been updated, but there is a group. It is an existing group. They're an active group, so you can certainly reach out to them. The article is not hyperlinked on the slide, but it will be in your slide. It should be in your slides that you downloaded at the beginning of the session. Debbie can go ahead and send a link to those slides once again. I believe it's in the slides, or on the very last slide I have a link to some resources, but if you are unable to find it, I'm sure maybe Debbie can look up a link to that article for you. This is an article, this is just to let you know that there are articles about criteria for developing consumer health collections, what you should be looking at. I will tell you the #1 thing to remember, especially right now, medical information is being updated rapidly. So I would really encourage you to be looking at online resources. Certainly if you don't have the budget or the funding to be purchasing access to online proprietary databases, be looking at what free ones are available, or local, again, those local libraries, the health science libraries, find out if they're open to the public, and if they can help you in developing the consumer health collection. I really encourage you to be looking at the online, because again, you're going to buy a consumer health book, and in 5 years you're going to need to weed it because it's going to be out of date. So just keep that in mind when you're thinking about physical collections versus online collections. I do know that a number of patrons prefer the physical versions. I know that that's important to a lot of users, particularly ones who don't have access to the internet at home, and the older patrons who aren't as comfortable with the internet, yes. But just keep that in mind. You will really need to be actively monitoring that collection for when things go out of date. So just keep that in mind for your collection development. All right, we are going to be looking at some in-depth consumer health resources. What I'm going to do is talk about a little bit some of the strategies you can be teaching your patrons on how to evaluate online health information, and then we are going to do a little bit of a deep dive into some of the freely available resources from the National Library of Medicine and other online sources. We'll probably take a break before we do a whole lot of looking at resources, but let's just go ahead and talk about some of the things you can be teaching your patrons about how to evaluate these resources. So I really like this ABC method of evaluation, really the A's, the B's, the C's, and user-friendliness, which doesn't fit into the A, B, and C. But this is a really great tool. There are, of course, other tools to be teaching people how to evaluate health information when you find it online. Certainly, the authority of the source, I tell people don't use WebMD, use Medline Plus is my #1. Accessibility, that's another great A to add to this list. I think that goes along with user-friendliness as well. Is it accessible, and also is it easy for people to use, or kind of go together? But certainly authority, if you can direct people to some of the better health resources, try to guide them away from just Googling or using WebMD. And using some of the things from the National Library of Medicine and from other authoritative sources like the CDC, like the Department of Health and Human Services. That's going, no Dr. Oz, please. Looking at that authority. Accuracy is going to be something that's a little bit harder to judge, but there are ways to figure out how accurate a website's information is. Bias is a big one. For WebMD, that's my #1 tip. There can be good information on the website, but just I steer users away from it because of that bias issue. It is funded by some major drug corporations, so there are going to be some advertisements and promotion of that. I would be very excited to hear if it was moving away from that. But certainly bias is something we need to think about, particularly for some of the more up-to-date. I saw in the chat there was a question about supplements. Herbs and supplements is a recent thing. There is not a ton of research on it right now, so that's one where users might have to find some other resources by searching around, but bias is always something to keep in mind. I like that tip, using the .org, .edu, .gov sites. That will really help you be able to determine if it's an authoritative source, if there is a bias. Looking at ads, if it has a lot of ads, probably it's not going to be something that's going to be giving you as good information. Wikipedia is really a mixed bag. It's something I know for the National Library of Medicine, the National Network, we've actually really worked at trying to add authoritative health source information links to Wikipedia. We've had a Wiki Edit-a-thon in April, and I believe there's another one coming up in November where we get people across the country to help us edit the Wikipedia articles and adding the links to the National Library of Medicine's resources, to other authoritative information and resources. So Wikipedia is mixed, but it is something to remember. You need to be evaluating the source, whatever it is that you're using. Right, it's a good starting point, but not probably a good ending point. Very good. So currency, the date is always going to be important. If you can't find a date anywhere, it's probably not going to be something you want to depend on, especially with health information, the rate at which information is being updated, being rapidly changed. That's going to be really important to remember the date, the currency. Great, I saw some conversation about the HON code, H-O-N code. It doesn't necessarily mean it's accurate, only that it's being transparent. All right, so maybe WebMD is saying, we are paid for by drugs. They say that, but it doesn't necessarily mean the information's accurate. All right, thank you for that. I really appreciate the extra comments coming in the chat box. This is really great. That coverage issue, that last point there, the last C, the coverage, thinking about how inclusive a source is it only looking at one type of individual when it's talking about health information? Are we only talking about healthy, 20 to 30-year-olds when we're looking at the effects of a supplement or, whatever. So thinking about that coverage issue is really giving you all of the information you need. And as we mentioned, accessibility and user-friendliness is something that you can be thinking about for a website. It's an important thing, particularly as more and more information is put online. Accessibility is becoming more and more of an issue for people who don't have access. So something certainly that's great to keep in mind. All right, so I do want to dive into some of the resources here, but I want to take a quick break. So what we're going to do is it will just take about 5 minutes. If you need to run to the restroom, grab some water. If you're getting ready for your lunch break, prepare your lunch, whatever. We'll take just about 5 minutes. We'll come back at 10:51 a.m. That's Central Time, so in 5 minutes. So take a quick break. We'll be back, and I'll show you some of these great resources. Be back in a minute. All right, it is 10:51. Hopefully everyone's back from their quick break. Stretch your legs a little bit. We're going to go ahead and move on and look at some of these resources that are available from the National Library of Medicine. Go ahead and, if you want to, give me a check mark. If you look on your screen above the chat box, there should be a little line with a hand raise, a check box, a X, other things. If you would go ahead and click a check box if you can hear me. Just make sure we have some people back. Great. Okay, wonderful. Excellent. All right, it looks like we have at least the majority of people back in the session. Wonderful. We'll go ahead and keep going then with our session today. All right, so the first thing I want to do is to show you the National Library of Medicine's website. So again, this is going to be, this can be your first stop for linking to all of the resources that are available from the National Library of Medicine. You can see the URL there on the bottom of your screen. It is not clickable here. You can click on it in your slides if you have your slide deck, or just type it into your chat box. Also, as much as we say don't Google for information, if you Google NLM, this is the first thing that comes up. So if you're forgetting where to find it, you can just Google NLM for National Library of Medicine. It will come up. This website has gotten a makeover. So if any of you had seen this website before, it has been updated. This is something, you can see the little thumbnail there on the lower left-hand corner of your screen. That's a picture of Dr. Patricia Flatley-Brennan. She is the director of the National Library of Medicine, and she's really been behind this push to update our website, make it more user-friendly and more accessible. So it's now purple-colored instead of blue, for those of you who saw the old version. A couple of things to point out for you here on this website. You can find links to some of the products and services you see up here in the upper left-hand corner of your screen is going to be links to the products and services. They're also available here in the middle. These are some of the most used resources are right there available in the middle. PubMed and Medline Plus are going to be the two most used. Medline Plus will be the primary consumer health resource, and we will look at that in just a moment. You can also find, let me change my arrow here, there we go. Here in the lower right, they're going to be looking at upcoming trainings. These are going to be all of the trainings that are available from the National Library of Medicine. So I didn't capture all of them, but actually this class we're in right now is on this list. So this is one place that you can be looking for more upcoming training on some of the NLM resources, but you can also, of course, look on our website, the nnlm.gov. But really, if you forget any of the other links for today, if you remember NLM, you're going to be able to use that, hop over to any of the resources that we talk about. They're all there under products and services, and I'll show you that in just a minute when we do some live sharing. So now I really want to dive really deep into Medline Plus. Medline Plus is the primary consumer health resource from the National Library of Medicine. It's going to be the main one to point people to, and many of the other resources I'll go over today have links from Medline Plus. So if you start from Medline Plus, you can still get to a lot of the other resources that I'm going to go over today. So I'm going to go ahead and live share my screen. What's going to happen in a minute is the chat box and the attendee box will go away. You will be able to open them again. So here you should be seeing my Firefox, my web browser. If you go to the very top of your screen, there should be a little tab that says you are viewing Sarah Miles' application. If you pull that down, there will be a place to bring back the chat box and the participants box if you're interested. I'm going to go ahead and have them open on a different screen, so if anyone has comments, I will see your comments. So I just wanted to show you all here, if you forget everything else and you remember NLM and you Google NLM, the first thing that comes up is the National Library of Medicine. So you can go ahead and click on that. It'll take you to the National Library of Medicine website that I showed you before. If I scroll down here a little bit, there's the class you're in right now, listed on the upcoming training. There are some great news and highlights and resources here as well. But I wanted to show you that if you're pulling down the products and services menu, it's going to list the most used products and services from NLM. So PubMed is one of the top ones, MESH, UMLS, and then Medline Plus is going to be the one that you all will probably be using the most often in your public libraries or to answer any user questions about health. So it's there in the drop-down menu of products and services. It's also here as an icon. And if you're looking for any of the other products and services, you can click on that All button, and it's going to take you to a full list of all of the resources that are available from the National Library of Medicine, and there are search terms, and you can search for them through here. So this is going to list all of them for you if you are looking for one of the other ones I talk about today or any of the others you can learn about in some of our other trainings. Well, let's move on over to Medline Plus. Medline Plus, again, is the top consumer health information resource from the National Library of Medicine. I'm going to give you all a quick tour of this today before I go on and talk about a few other resources, because this really is, I say, the bread and butter of consumer health information. If you're helping someone answer a question, this would be my first choice to go to first. So there's three main sections of Medline Plus. There's health topics, drugs and supplements, and videos and tools. There is other information beyond those three, but those are the three main areas. You also see this is a new thing that's included on the website, lab test information. So if someone comes into your library and says, I just had this test done and I want to know more about it, that is now available on Medline Plus as well. So you can learn why your doctor ordered that test and what the results might mean. This is really exciting, a new update to Medline Plus that exists. There's also a medical encyclopedia. We talked about terminology being such a hugely difficult thing for people, particularly the medical terminology being such a higher level. This encyclopedia is going to give you articles and images for some of those disease, symptoms, tests, treatments. Some of those terminology you can look up here in the medical encyclopedia. You can direct your users to be looking them up here as well so they can understand what those terms mean. Yes, thank you, Debbie. That herb list that we see here, this box here is for announcements for some of the latest updates, and herb list is one of the latest that's been released from one of the other centers in the NIH. We'll be looking at them in a second, but this is their latest. It's an app that lists herbs that you can take, and so acai berries or acai berries is apparently how you pronounce it according to the herb list information that I looked up yesterday. So that's a brand new resource. This area here is used for some of the latest news and information. There is a Twitter feed for Medline Plus. And there's also this really great resource, the Medline Plus magazine. If you're not familiar with it, it's something they come out with 4 times a year, quarterly, in the English version. It is written at a lower literacy level, and it's completely free for you to order for yourself or for your library. You can get an individual subscription for yourself, or you can order up to 50 copies at a time to be sent to your library. You can have it available for patrons to take. It's a really great lower literacy resource for health information. The topic rotates every issue. They try to put someone fairly famous on the cover. And I have to admit, I don't know who this particular individual is, but earlier this year they had Jim Parsons from The Big Bang Theory was on the cover. They've also had Michael Phelps, Nick Jonas. They try to get someone fairly recognizable, a celebrity, to put on the cover, and they connect it with the topic. So this particular one is caregiving. I believe this is a celebrity who has had a family member with a serious health issue, so caregiving is the topic they chose for this issue. But there will be several articles in there. It's a really great resource for that lower literacy. If you go to Medline Plus, just click on the thumbnail. It will take you to the Medline Plus magazine website. The edition is available there online, 100% online if you want to look at the online version, and then you can also submit a subscription request if you are interested. There is also an English language edition. That's something that's really great about Medline Plus. The entire website is available 100% in both English and Spanish. So you see here on the upper right-hand corner of your screen, if you click on Español, it's going to take you to the Spanish version. And you can see here that a lot of the things are the same, the health topics, drugs and supplements, videos and tools. We have the lab test information and the encyclopedia, But the other things are different. They're posting information, resources, and tools that are specifically relevant to the Spanish-speaking population. And as you can see, there is also a magazine in Spanish. That is Taboo from the Black Eyed Peas. He's on this edition. The Spanish edition is also available for free subscription. It is, however, only a once-a-year edition. It is completely a separate entity from the English. It's not just a translation of whatever the English article is. It is, again, stuff that's relevant for the Hispanic community. And one thing I really like about it, because I do not speak Spanish, as you probably can tell from my terrible accent, the edition is 100% in both English and Spanish. So it's also a really great English as a second language tool if you're interested in that as well. So I'll go back here now to the English language resource. I really like highlighting that magazine. It's a great free material that you can give out to your patrons with really great health information. There are other resources in other foreign languages here at the bottom. You see there's a couple of links. The easy to read materials is the link I showed you all earlier when I talked about Medline Plus and Health Literacy Easy to Read materials. You also have organizations and directories. This is a really great place if you're trying to help people find a health provider. They provide directories of health providers and also organizations here on the website. And then here we have health information in multiple languages. The last time I looked at the number, it was I think about 60 other language information that are available there. I believe Arabic is on there. Let me go ahead and click. We're looking at it live, so we can go ahead and click. There is some Arabic information included here. Now, the caveat here is that the website is 100% in both English and Spanish. The other languages, some of the material is limited. So if we look at Arabic, for example, there is quite a bit of Arabic on here, actually. There's a few languages, some of the more obscure languages. There isn't going to be as much material here, but you can go here, look for the language you're looking for, see what they have available. And another great thing, it is the bilingual version. So you can print it out. You know what it says when you hand it to your patron in that foreign language. So as I said, a lot of other health information in other languages. HealthReach is another database. That's where a lot of this information is being pulled from, and there are more resources there. So if you do have another language that you're looking for materials for, you can find that on Medline Plus or on HealthReach. So back now to the home page, and Medline Plus Connect, I just want to mention, since we've talked about all the other links down here, this is a special tool from the NLM that gives hospitals the ability to link directly to Medline Plus articles from patients' electronic health records, or EHRs. So that's something, if you're in a hospital and you're not sure if your hospital has this, maybe think about Medline Plus Connect as a possible resource to discuss with your supervisor or with your hospital group. But I want to talk a little bit more about what content you're going to find in Medline Plus. There is a search bar just like in Google, so if you just want to go stick something in the search bar, you certainly can. The health topics is going to be a great place to start. They have over 1,000 health topics. When they hit their 1,000 marker, there was a great social media push when they hit 1,000, so it's over 1,000 right now. You can search for topics alphabetically. They also organize them in a lot of other helpful ways. You can look by body location, the body system, with these icons here for a little bit more accessibility. We also can search by disorders and conditions, and what they have listed here are going to be the most commonly searched for disorders and conditions. Certainly cancer, diabetes, substance abuse are some of the most searched for topics. That's why they're listed here. You can also look at diagnosis and different therapies. That's another way to be looking through these health topics, and we also have them organized by demographic groups. So one of the things I really like about the demographic groups is they have pages specifically designed for these different groups. There is information specifically designed for the children and teenagers, the K through 12 population. There's also information specifically for seniors on here. So many of the pages, if you go to a health topic, it's going to have extra information for these demographic groups, but you can also start with the group and go from there. The last category is there is health and wellness topics collected here. I know certainly nutrition is one of the top topics that comes up in public libraries. Certainly cookbooks is one of the most popular sections I remember from my time in the library. So food and nutrition is one example of some of the health and wellness. But let's go ahead and click on one of these health topics so I can show you what a page looks like. And I really like using asthma. I'm going to use my search tool. There it is. I can click on asthma. This is what a basic page is going to look like on Medline Plus. You can see there's a very helpful table of contents there at the top that you can jump right to whatever section you are looking for. So you'll see some overlap from the page we just looked at. We're going to have the demographic groups here, children, women, and seniors. We also have handouts. They're PDFs that you can print off and give to people for those who want the physical copies of things, who want the materials. There are patient handouts here. You're going to have a summary on every one of these health topics pages about whatever topic it is that you're looking at, and you also have links to research. There's statistics and research, information about any clinical trials that are happening, as well as journal articles. So anyone who's looking to go beyond the basic information, the basic easy-to-read materials, and is wanting to look at the research, you can link from here as well. The images that are included, there's an image with every health topic. These images are available for anyone to use as well. I believe they are, if not Creative Commons licensed, they are an open license, so people are able to reuse these images if you'd like, if you need some images. This is a great place. You're also going to see the medical encyclopedia is going to automatically be showing you the entries where asthma comes up in the encyclopedia. Certainly allergies is a very common topic. Exercise-induced asthma is another common one. We also have related health topics, so linking you to other things that are going to be related. Asthma in children is a huge one. This is another resource, another health topic here on the website. It's also going to give you information about some of the other institutes. There is an institute dealing with asthma that would be the National Heart, Lung, and Blood Institute, and you can find some of that information in other languages here as well. I want to point out, when you are looking at some of the resources here, it is very clearly labeled where the information is coming from. So thinking back to our ABCs of evaluation, we're going to have very clear attribution and very clear ability to say this is authoritative or not authoritative health information. So really great way that they put out this material here. Let's see, scroll down a little bit more. We have different sections like living with, related issues, specific things related to genetics. We have more images here. We're going to have some health check tools, some videos and tutorials, just lots of great resources for all of these health topics. So excuse me as I scroll back to the top of the page. This is a basic overview. All of the health topics pages will look very similar to this. It will include all of the same kind of information here available for your different health topics. So now a mention to drugs and supplements. Certainly this is something that has come up, and it is something that you get asked quite frequently in a public library. We also have a couple of other resources that are going to be looking at drug and supplement information, but you can do it all right here from Medline Plus. Like I said, this is really a one-stop shop, and it links you out to all of the other resources that you can find. You can search for drugs by their generic or brand name. Again, you can use the search box. If you want to, it's going to do the same thing and pull them up, or you can be browsing a list. There is also a specific list of herbs and supplements, so this information can tell you if there's been research done to tell you if something is really going to have the health effects that you want it to, what the research is, what are the interactions of that herb or supplement with other drugs that you might be taking. All of this information you can find here on the drugs, herbs, and supplements section. Finally, the videos and tools is one that's very popular, particularly for any K-12 programs, for any students, for any teachers, or in a public library if you're doing some of your teens or children programming, this is a really great resource. Some of the videos, the health videos are going to be short, about 1 to 2 minute videos about anatomy, body systems, and different diseases and conditions. So for example, one of the asthma-related videos, there's one on allergens, talking about how allergens affect your body, what happens when you breathe in pollen, and it's just like 1 minute and 10 seconds. They're very short videos, very informative, instructive, and easy to understand, and they are available for a number of different health topics. There are also surgery videos. These are going to be not for the faint of heart. They're usually about 4 hours or more. They're videos of actual operations and surgical procedures. This is not going to be for the general population, but it is a great resource for anyone who might be in school to become a health professional, or for someone who is actually going to have a surgery done. It's something that we've had, you know, particularly someone older getting a surgery, they may be a little worried about the procedure, and for some people it helps them be able to watch a surgery of what happens. Great. Seniors really love these resources. Great. So those surgery videos are available. This is something that's really hard to find other places online. Again, the issue with privacy and HIPAA, and these are available for anyone to see. They are available online. So Health Check Tools is another really great resource. I'm going to go ahead and click on this one for you all. There are a number of tools that people can be using to check different parts of their health. So one that's really great is there is an alcohol calorie counter, interactive worksheets. Here it is, the alcohol use screening to look at, particularly for college students. Are you drinking too much alcohol? There is the health check. These are great tools for someone to be checking where they're at. There's calculators, quizzes, questionnaires. You can check your risk. There is a note there, yeah, the surgery videos are actual surgeries, real live people getting surgery. So definitely, if you are squeamish and don't like blood, don't watch those. It's definitely a very specific group of people that are using those surgery videos, but that is a good caveat. But the Health Check Tools is a really great way for people to be learning more about their own health, doing their own check of their health information. Certainly something that they should take to a doctor if they have concerns, but really great tools for people to be using. Now, everyone's favorite is some games. There are some really wonderful games that are put out by the National Library of Medicine, by a couple other foundations. To Tell the Tooth is one by the American Dental Association. Lungtropolis is another one of my favorites that's specifically for asthma and allergies. So the games here can be really, really fun. Some of them are designed for younger students. Some of them are designed for a little bit older students. Usually the website where the game is located will tell you what the suggested age group is. We also do have a class on K-12 resources that will look more in depth at some of these, but this is a great resource for your K-12 audience. I will admit I've had fun playing the games too. They are educational, so the idea is that they're fun. It's gamification of some of this health and science information. They're really, really great for students to be using. It's a great resource for teachers if they want to develop a program around one of these, or as a librarian if you want to do something around one of these games. It's really a lot of fun, some of these games. And many of them are available as app downloads to both Apple and non-Apple devices. So look into that if you're interested in finding out more about the apps. And as you can see here, we also have a few tutorials that they've started adding. There's an NNLM update podcast that's available that you can hear about some of the latest updates that might affect your health information. There is a tutorial on evaluating health information as well as understanding medical words. Certainly terminology is something that we've discussed. So these are also available here on the website. All right, so I'm going to go ahead and stop sharing my screen now. So you should be returned to the regular view. Again, the link there is in the corner for that Medline Plus, medlineplus.gov. This is another one. If you forget, Just Google Medline Plus, and it will be the first one that comes up. I don't know if I mentioned earlier, but if anyone does have any questions, please feel free to just throw them in the chat box. I'm happy to answer any questions about any of these resources that I have for you. So Medline Plus is really my favorite go-to resource for the general public. I've used it for myself to look up information. It is really going to be your best #1 resource for some of these health questions that your patrons might be asking you. But there are a couple of other resources that I can highlight that will be useful for specific information. For example, this first one is the National Institute on Aging. It is one of the other 27 institutes and centers located at the NIH. And this is really a great resource if you have a lot of seniors looking for questions. It has gotten a little bit of a makeover, the new NIA website. There's going to be health information here, very similar to the health topics that were on the Medline Plus. The health information here is going to give links to that information. There's also links if people are interested in finding out what research is being done, and if you're in an academic or university setting and you're dealing with researchers who are interested in funding, there's also information here for funding resources, as well as news and events about upcoming information. So this is a great resource for anyone looking specifically for information for your seniors. There used to be another resource for seniors. That website was really not getting a lot of use because the Medline Plus website has that demographic group for seniors. It's very easy to get that information there. And then, of course, this National Institute on Aging has a great website as well. So this is a great resource for the seniors. Another website to point out for you all is clinicaltrials.gov. This is going to be a resource for any of your patrons might, come out and wondering about what are some local trials they might get involved with. This is something I've heard that public libraries are getting this question. What are some clinical trials going on that I could get involved with? If you've just gotten a diagnosis and you're wondering what are some of the latest studies being done, this is another place you can find information about those studies. This website was also just redone as well. This is, I believe they've moved past the beta stage. This is the official version. You can find studies, information about the studies. This is also where researchers can submit studies to be listed. If you are getting funding from the National Institutes of Health, it is required that you list your study in this database. There's a number of ways that you can search for the studies. You can be looking for a specific type of condition or disease. You can be looking at countries. There are maps on here, so you can be finding local studies if someone is interested in joining a study. One of the things that's available in the advanced search is what studies are currently recruiting in your area, what ones are open and ongoing, and what ones are finished. That's an excellent point. Thank you, Catherine. Sometimes these studies need not just the sick people, they need the healthy people. They need a control group. So sometimes people will come in and say, I'm interested in helping out with research. How can I find a study? That's a great thing to keep in mind. Thank you, Catherine. Anyway, so these really great resources for finding out clinical trials, ongoing, what's finished, and it will have a link to some of the latest studies. So perhaps not for the low literacy level patrons that you have, but if someone is looking to join a study, you can help them find one, and if someone is looking for research or ongoing studies, this is a great resource for them as well. And as you saw when I was on Medline Plus looking at a health topic, one of the things listed on the page is a link to ongoing clinical trials related to that topic. When you click on it, it's going to push you over to this resource, to the clinicaltrials.gov website. So this is one that I mentioned earlier we were going to come back to. It's the National Center for Complementary and Integrative Health. They are the one who just released the Herb List app that came out. This is going to be a really great resource for those who are looking for additional information on some of those alternative health practices, alternative medicine. So things like yoga, herbs, supplements, a lot of that stuff that's really trending right now, you're going to find really great resources and information on this website. Again, as you can probably tell, it's another one of the 27 institutes and centers. The abbreviation is NCCIH, if that's easier for you to remember. Yeah, I believe there is information about medical marijuana on this website. I know that is something that's currently being researched, so I'm not sure how much information is available here, but I would guess that this would be a good place to find information about that. It's going to have health topics A to Z the same way that Medline Plus and many of the other resources do. We have the herbs at a glance. This is going to be some of the same information that's available on the Herb List app. You're going to be able to search for and find on this website. You can also find how to find a practitioner. This is specifically for a practitioner in complementary and integrative health. So if someone is looking specifically for that kind of treatment, this is a great resource for finding that kind of practitioner. There's also information for healthcare providers. So if you have a physician, a nurse who's looking for more information about this, it gives you links to what evidence-based medicine does exist, what is the evidence that does exist so far, opportunities for continuing education, clinical practice guidelines, etc. And as you can see, there's also that link to some of the research that's going on. There are links to grants and funding, as well as training, news, and events. You're going to see a very similar template for all of these websites that are from the NIH. They've really made an effort to make the websites really user-friendly by making them all the same, very intuitive. Here's health information, here's links to research, here's links to grants and funding, etc. So you're really going to see a similar trend across all of these websites that make it much easier for people to navigate. And thank you, Debbie just confirmed medical marijuana information is available on this website. So if you're looking for information about that, about other herbs and supplements, this is a great resource to look at. Another institute that's usually the one that people have heard of, not everyone has heard of the National Library of Medicine, unfortunate or not, but a lot of people have heard of the National Cancer Institute. Certainly cancer is still one of the highest killers, one of the highest causes of death in the United States. Cancer questions will likely be a large percentage of some of the questions that you're being asked, and the National Cancer Institute has the resources specifically for cancer. There are resources for cancer risk and prevention, so this can be something people who are not currently diagnosed but are looking for ways to prevent cancer. There is a blog with current information, some of the latest updates. As we mentioned, these updates happen very rapidly, so there is a blog with updates on that information, as well as people who have received a diagnosis, additional information. There is a search bar, and as you can see, there's it's a little bit different setup because there aren't health topics. This is really just on cancer, so there are cancer types, as well as the research, funding and training, news and events. So this is a great resource if you're looking specifically for cancer. Yes, thank you, Nicolette. Cancer, asthma, diabetes, and Alzheimer's are really the heavy hitters here. So the National Cancer Institute is one that people usually have heard of, and it's a great resource to direct people to who are looking for that information. All right, just a few more resources to go over, and these are ones that are specifically drug-related. I mentioned earlier that we have several drug and supplement-related databases for people, and really the 3 drug databases that I'm going to show you, they're separate websites, but really they're going to interact with each other a lot. So even if you don't remember any of them, again, a lot of them will be linked from Medline Plus, but if you know you're looking for a specific drug question, you can be looking for one of these particular databases. So the first one is Drug Information Portal. This is a resource that you can look up drugs by category, by name, either generic or brand name, and it's going to be listing you just the general information, ingredients, manufacturing information. This is an old screenshot, so right now it has 70,000. I'm sure that number has gone up for the number of drugs that have information available in this resource. It's not a hugely user-friendly website. As you can tell, it has not had a makeover yet. There are a lot of websites, and this one just hasn't gotten it yet. It is coming, I hope, for a makeover. But this is a great resource if someone is looking specifically for drug information, the generic names, interactions, things like that. It is not developed for low literacy. It's not really an easy-to-read database, so keep that in mind if that's a concern with the question that you're answering. But this is really the first base level. All of the information is included here, and as I mentioned, Medline Plus and the other drug resources link back to this portal. It's really the portal for all of the information about the various drugs that they've gathered. This second one looks a little nicer. It's had a makeover a little bit more recently, and I really like this resource. It's called Daily Med. What's great about this website, not only has it had a makeover, it's a little bit more user-friendly. It includes some of the FDA guidelines and information for different drugs. It will be linking back to the drug information portal for some of the specific drug information. But another great thing that this website is for, again, you can be looking up drugs, finding out their interaction information, the possible side effects, the FDA guidelines and information. They also have PDFs of the boxes and labels from drugs. So if you go in here and you search for Tylenol, it's going to have all of the types of Tylenol, and it's going to have PDFs and images of both the label itself and the box. So say someone discarded their box, they got rid of their box, they want to know what were the cautions on that label, when was I supposed to take it, I don't have any of that. They can find all of those here on this website. As well as they have animal drugs. This is one that's unique to DailyMed. There are certainly a lot of human drugs, but they started including animal drugs as well. So if you're interested in finding information about what your vet has prescribed for your dog, or what are possible side effects of certain drugs for your animal. It's not just dogs. I have a dog. That's why I went there first, but there are other animal drugs as well available on this website. So this is an excellent time for this question here in the chat box. How do you put package inserts and the PDR in context for patrons? My doctor prescribed stuff that people died. Well, so yeah, and we have that you won't take anything with any side effects on the insert. That is something this website does include some reminders and cautions. I think it's really important to put things in context. So that one with the people died from taking this drug is really to remember the statistics. So putting it in context, not just saying like 92% effective, but saying this means that, you know, a certain number of people, that idea of numeracy, being able to quantify something for people, to tell them, look, yes, someone died, but that was one person in a million people, and that's something that you can really direct them to their health professional for. If they're being subscribed to this by their doctor, I think it really goes back to the issue of the trust of health professionals, and that is an issue. Unfortunately, it's not one I think that we're tasked with dealing with. It's something that maybe is difficult for librarians specifically to be dealing with, but the trust of the health professional I know is an issue, but it is something that will be a continuing process. And another webinar series that we have going on, certainly something that many physicians are looking at, is the issue of patient safety, making sure that the safety of the patient is primary in the healthcare process. It is something that's going on right now. We are working with a number of health professionals as well as health information professionals about how to really increase the safety of patients, how to improve the trust between the patient and the health professional. It's an ongoing process, and I think it's something it's good to keep in mind as information professionals when we provide this information to people. So hopefully that addressed that question a little bit. Again, DailyMed, so it has really great resources both for the animal drugs, for the human drugs. It will have some of those labels and available to you, and it will link you back again to Medline Plus as well as the drug information portal. The thing I really love about these drug resources from the National Library of Medicine is they really work well together. It does push you back and forth between them, but it's the best way to really get all of that drug information that people are looking for. They can start with whichever one they want, and hopefully they'll get to whatever information they're looking for. The last one I want to highlight is one that will link when you click on this last link here, the tablet capsule ID tool. Is called Pillbox, and it's one of my favorites to show people how to use just because it's a really fun resource. It's a way to identify a pill. So say you have an elderly relative, you go to their house and you find pills all over the floor, you don't know what they are, have they missed their prescription, what is going on with those pills? Or on the flip side, if you're a parent and you have children of a certain age and you go into their room and you discover some pills, you don't know what they are, how are you going to figure that out? So this is a really great resource for identifying the pills. This is another one they are working on updating this one and adding additional functionality to it. Right now the way it works is that you fill out each of these boxes with as much information as you have. If you only have one, that's fine. If there's any imprint on the pill, what shape it is, what color it is, the size. If you know the drug name or ingredient, you can go ahead and just search for it here, and it's going to show you a picture of what it looks like, as well as linking you back to information on Daily Med with the labels and drug information portal with the drug information ingredients and that sort of thing. Again, you can fill this out with as much or as little information that you have, and it's going to pop up a list with pictures of the drug that you're looking for. What they're working on right now, I believe, is they're working on getting a version where you could upload a picture and it would search for you. I know that's something that Google developed over the last couple of years, where you can reverse search an image. You say, I have this image, where did this come from? You can put in your image and it's going to help you find where it came from. That's what they're working on for Pillbox. I do not believe they have a target date right now, but I do know that it's something that they're working on. So that was a question that came up the last time I taught this class. They are working on that as an additional functionality. But this is a great tool. Again, it's for a very specific use. You're trying to identify a pill, what kind of drug is it, or you're trying to see what does this drug look like. It gives you pictures of the pill as well. So this is a really great resource, and as I mentioned, it does link you back to the other resources also. All right. And this last resource is just the last supplement. We mentioned supplements is something that is trending right now. Certainly the National Center for Complementary and Integrative Health will be a great first step. This is another resource that you can use for those questions as well. This is one to sort of fill in the gaps of the drug website with some of the supplements that are not FDA regulated. So we can see here the FDA regulations are not as strict for supplements right now, so we have this disclaimer here, and some of the information here, again, we're not going to have as much research on because it is something that may not have been researched yet. But this is a great tool for looking at some of those dietary supplements that may not come up when you search on one of the drug resources. It's really, it's a supplement to those websites with supplement information. And I like to include it just because supplements is such an important thing coming up right now. All right, now that I've shown you all of the resources, and again, if you do forget any of the information, don't worry, the slides are available. You can look at those. And also remember, if you have Medline Plus, you probably will have a link to all of the other ones as well. But I think it's really great to remember what are specific instances that you can use each of these resources for. Oh, thank you so much. We talked earlier about the Medical Library Association Consumer and Public Health Information section, and they've recently redone their top 100 resources. Thank you so much, Catherine, for sharing that link. So that was the group with the Medical Library Association I mentioned for the collection development. So it's possible the book list has not been updated, but they have updated their top 100 resources. Excellent. I will make sure to add that link to my PowerPoint in the future. I appreciate that. Thank you. All right. Now that I've shown you all of the resources you could possibly want, there are more. There are more resources available. Some of the other trainings that are available from the NNLM will cover some of the other resources and some of the other instances you might want to use that information. But now I want to take a little bit of a step back. We talked in the beginning of the session about the importance of health literacy. We talked about the reference interview. We talked about planning a service, the collection development. Some of these resources will be really great for you to include in your collections on your websites. But I want to talk a little bit more about that collaboration piece that came up earlier when we talked about designing a service, and also a little bit more about health information outreach. So I mentioned the NNLM, gave you a little bit of an overview. This is a look at what the website looks like. It's nnlm.gov is the basic website, and that's where you can find more information about your specific regional office. I mention this because our offices around the country are really dedicated to this, to helping people find authoritative health information. So when you are designing a health information service, or if you have health-specific questions, I really do encourage you to reach out to our office. Not only do we want to help you answer your questions, we have free resources that we want you to use. As my boss says, take our money, take our classes, and take our free stuff. That's what we want at the end of the day. Any way that we can be helpful for you in helping your users, that's what we want at the end of the day. And we love partnering. Partnering is something we're very, very passionate about. And even if we can't partner with you, maybe we can find someone who can partner with you. So I just want to remind you of us as a resource. We do also have funding. This is different for each office. Here in the South Central region, we have quite a number of project awards that we give out. All of the projects from all of the offices will be a yearly basis, but it's designed for you to have a program in your library that's doing outreach into the community. Certainly public libraries, university libraries, some of the other health organizations we work with are going to have that community audience. You already know what's affecting your users, you know what's needed in your community, and certainly that's what we want to help you to do. So we do have some of these resources. We do have funding available for you to apply for. So some examples, this one here on the upper left is a senior health information class. I believe this picture, not this picture in particular, but for our office, we have funded programs that we're helping seniors learn how to use online technology and look for online health information. So it was both a technology class as well as looking for health information. Certainly for younger students, younger kids as well, is something that we're looking at. So keep us in mind. If you are having issues, particularly with funding or with resources, maybe reach out to your local NNLM office and see if they can help. We've had a number of medical librarians, hospital librarians here on the call say they love for public libraries to reach out to them, possibly for partnerships, so keep that in mind. So a couple of other potential collaborators when you're thinking about these projects. And if you have any great partners that you've worked with in the past, or any that you can think of that I haven't listed, go ahead and throw those into the chat box. I always love hearing what are some great partnerships that you've had, or organizations that are really, really great to work with. Go ahead and throw some of those in the chat box if you do have any. I mentioned hospital libraries. There is a hospital library section of the Medical Library Association. We've had several hospital libraries here on the call. Thank you all for being here today and for sharing your services with us. That's a great collaboration for public libraries to reach out to hospital libraries. I did mention the Medical Library Association is a great resource for the health sciences and medical libraries. Don't forget your public health departments. Often the public health departments are already doing programs in your community, and it might be a really easy way to say, hey, you're doing this program, why don't you come and do it in our library space? We have the space, we have the people, come and teach it at our space. I mentioned the hospitals, not just the hospital libraries. Certainly hospital libraries are a great resource. Unfortunately, not all hospitals have hospital libraries. So hospitals in general, health professionals can be a great resource if you're looking to do something. Particularly mental health and substance misuse is unfortunately a trending topic. Maybe ask a local health professional who has expertise. A prevention specialist in your area can partner and come into your library. We have some great things coming up here in the chat box. A local LGBT, I always get to add different acronyms, mixed up at a local center. That's wonderful. A specific one there for Southeast Michigan Public Libraries. There's a hospital. Local community health support groups, that's a great suggestion. We have a local group here in North Texas that's specifically for patients, and it's a group that we're teaching a class for in a couple of weeks. Senior centers is another really great one. Certainly seniors using the library is a high percentage of your users, I imagine, particularly in certain communities. The senior center is a great one to partner with. Local schools is another great one, certainly for some of our K through 12 resources, and when you're doing your K through 12 programming. I'm sure we're in the midst of summer reading programming right now, so that's something that you can think about working with the schools on in the future. Different organizations in your community, these are really great suggestions. Another suggestion that's not here on the screen is to reach out maybe to some local nonprofit community-based organizations. For example, United Way is a great one. They are a partner that we've worked with a number of times. They actually have a very similar mission to the National Library of Medicine, certainly in the aspect of improving access to health information for the general public. They also provide funding for a number of partners. So think of those nonprofits, especially if you're looking to work with a specific audience, maybe see if there's a community group in that area as well. So these are just all possible ideas if you are looking at creating a service, or if you're seeing a specific need, a topic is coming up over and over again, reach out to one of these partners and see if they're willing to work with you to really design a great program for your users. Another resource I want to mention from the NNLM, certainly when we do programs showing the impact and showing the need, that needs assessment piece, if you're having issues with that, we do have one of our national offices. There's 8 regional medical libraries, but there's also 5 support offices, and one of the offices is the NNLM Evaluation Office. They have a number of resources on their website. They have evaluation guides that can really walk you through how to put together an evaluation or a needs assessment. I believe they are revamping some of their courses, and they're hoping to offer some of those soon for online trainings as well. So if evaluation in particular is something that you're struggling with, go ahead and check out it's the National Evaluation Office, or NEO. Check out the NEO website for additional evaluation resources. And here I have another article. It is a little bit dated at this point. I'm not sure if they've released an updated version, but this is specifically on the challenge of providing consumer health information services in public libraries. I have a PDF there. It's also in your slides if you downloaded them earlier. This is walking through what you need when you're looking at providing consumer health information services in your public library. Certainly it's going to speak to some of the programming, it's going to speak to collection development. Give this one a look. I'm not sure if there's another newer, better article out there, but this is a really great resource for anyone thinking about how you're going to provide this information in public libraries. Let's go ahead and check out this article. I really like this one. All right, so I want to move a little bit from, we have an idea for a service, we have a partner, we're really excited, but we need to get bodies in the room. How are you going to get your bodies in the room? So certainly marketing is something that is maybe a little bit of a challenge for public libraries, but certainly essential, especially now with the number of demands on people's time, the demands on people's attention. Marketing is going to be really essential to getting people to use your services. Certainly that competition for customers between libraries and other organizations, competition for resources, and making sure people know that you are there. This is something I know hospital libraries really struggle with this, and it's something we are working with hospital libraries to try to improve how they can market. It's a lot more difficult when you're in a hospital. Your access to resources is not the same. But for public libraries as well, making sure that you stay visible, that people think of you as a valuable resource in the community, and make sure people know about your programming. We want them to come. So many of you may already be doing this. You may already have great marketing programs. So I want you guys to start thinking of some ideas. Go ahead and throw some things in the chat box. What are some things that you're doing in your library, in your organization to market your programs, to market your services? What are the things that y'all are using for this? Food. Food will bring the people. Great, a newsletter blog. I really like that one. That one's tough. Daily is tough. All right, what are some other things that you're using? And I do have a list of suggestions for you all, but I'd love to hear more about what you all are doing in your libraries. All right, NEA Big Read, that's not one I'm familiar with, but health events, great. Meeting with those groups, just telling people that you're there. The health topic displays, I really love those, the health topic displays. Local newspaper, radio, and television can be a great resource to meet people. Certainly, if there's cost involved, you will have to do a cost analysis, but that can be a great resource. Oh, wonderful. So, Barbara, in a hospital, they're doing a promotion of the hospital library with social magazines and fiction novels to patients. Oh, I love that. And handing out hospital library flyers. That's a great patient resource. Excellent. Seeing a lot of newsletters, Facebook, social media, it is there, it's not going away. Make sure you make it work to your advantage. Calendars are also great. All right, these are some really great ideas. Here are a couple more in case you didn't think of these. The bookmarks I have on there, it's probably something you already have in your library, but if you're not aware, the National Library of Medicine and the NNLM has free bookmarks that you can order for Medline Plus. We also have other handouts, free flyers for all of our databases, or for many of our databases. So for Medline Plus, there's a flyer. It's both in English and Spanish. You can order from us. So certainly if funding and resources are an issue, see if you can find free resources to give out in your library. And the NNLM has some, and some of the resources that I've gone through today have resources as well. They have free materials that are available if you request it. Certainly we mentioned using local newspaper, local radio, the press releases. We have a past webinar we had about 2 years ago. We had the local PR guy on our campus talk about how to spin your story with the press. So if you are looking for more information about how to do a press release, how to do it effectively, look for some of those kinds of trainings if you're interested. The videos in a hospital waiting room I like. I really like what Barbara mentioned about giving out patient reading materials with information about the library. Many of you mentioned newsletters, speaking to community groups. The pedometer program is just an example of one of the programs that they were working with a local community groups and local health organizations. And thinking about health fairs, where can you make your presence really known? The health fairs usually are a little bit more local and a little bit more cost-effective than conferences, for example. So that's one thing. A lot of local school districts have health fairs. If you're not involved with your local health fair, maybe look into that. And some other really great suggestions here. So keep marketing in mind. Think about different ways that you might market your program and market your library to remind people of what you have going on. Very nice. So work with your partners as well, your health science library, your hospital, and get out to a local book fair. I like that. Excellent. So this is just a reminder, we're not going to actually go through this today, but if you've never created an elevator speech, you should always have one handy. Certainly for our office, we get asked a lot, well, who are you, why should we care? So we have one of these, maybe more than one version. If you haven't developed an elevator speech, it says 15 seconds there. I would say you could go all the way up to a full minute, but maybe have different versions depending on how much time. It's good to be able to talk more or less depending on how much time the person has that you're giving your elevator speech to. And remember, the three things you want to focus on: who are you, what do you do, why does it matter, why should I care? Those are the 3 points. Make sure you hit those, whether you're doing the 15-second version, the 30-second version, the minute version. Have different versions. Make sure you practice this. If you meet your mayor tomorrow, what would you want to tell them about your public library? What is something that you want them to do for you? So I really encourage, make sure you have this elevator speech ready. Certainly Limited resources are something we're all dealing with on a continual basis, and if you can have this elevator speech ready, it might just come in handy and help you get access to a few more resources. So again, keep this in mind, write this down, practice it. I also would recommend having a different version for different groups. So meeting the mayor tomorrow might be a very different elevator speech than talking to your supervisor tomorrow about a health program that you want to get started. So really make sure you tailor your elevator speech to different types of audiences, but always make sure that you hit these 3 points. So we're coming up to the end of our session here today. We are going to have a little bit of time for Q&A, but before we do that, I wanted to have this moment of reflection. You can write this down on a piece of paper. If you feel free putting it in the chat box, please feel free to do that as well. The first piece is I want you to think about 3, or even if you can't think of 3, what's the most important take-home message from today's presentation? What are you going to go home and say, wow, I'm so glad I learned about X from today's Beyond an Apple presentation? The second thing I want you to think about, again, if you can't think of 3, think of 1. What is one person you're going to share this information with? Who is someone you want to go talk to now that you've gotten information in today's session? So I'm going to give everyone just a couple minutes to write down a few notes on your piece of paper. Maybe this is the person that you write an elevator speech for. If you have that person for the second part, you can write it down on your paper. If you want to share it in the chat box, I'd be happy to see what people really got out of today's session and who they want to go talk to after the session is over. But if you don't feel like sharing, that's also totally fine. Great. Thank you, Marlo. Medline Plus, share it with your staff. Medline Plus for your hospital website. Excellent. I always tell people, if you remember nothing else, hopefully you remember Medline Plus. Great. Oh, wonderful. Oh, I'm so glad that they'll be useful for your clinical team as well. I'm working on some classes specifically for nurses that will present some of these resources for them to be using for patient care. So certainly these are resources for the consumer, but they can be adapted for a number of different audiences. Great. The health literacy piece, the easy to access information, patient education council is a great one to tell about some of these resources. We've had some wonderful hospital librarians as well as public librarians talking about partnering. Hopefully we've made some partnerships happen through our chat today. Yes, funding for fun stuff. Take our money and do fun stuff with it. That is something we always are excited to have more people asking us, how can I do this? How can I do this? Using our resources, that's what we're here for. Great. Thank you for those of you who share this. I really do appreciate you sharing. And even if you didn't share, I hope you got something that you're going to take home and some people you're going to tell about for today's session. So we are almost at the end. I want to open it up for any questions that anyone didn't have a chance to ask during the rest of the session. Go ahead and be entering those questions into the chat box. I do have a couple of more final housekeeping things for you, so if you are able to stick around just a few more minutes until after the questions, we will do our demographic poll as soon as I finish with the questions. But I want to give everyone a few minutes. If you did have any questions that you didn't have answered today that you would really like help with, go ahead and enter those into the chat box. I'm also going to navigate to this last slide so that you do have my contact information. So if there wasn't a question I was able to answer, if you want more information specifically from me, my email address is on the screen as well as my phone number, and that link is specifically to the South Central Region office. If you're in Texas, Louisiana, Arkansas, Oklahoma, or New Mexico, we're your peeps. Please reach out. And if you're not, you can find your other offices on the website. Thank you, Debbie. Debbie has also put a link to the slides. Once again, if you missed it earlier in the session, you can download those there. All right, I do have a question. If you do want to partner with a local public library, who is the best person at that library to reach out to? That's a great question. So I can tell you from our experience from the NNLM, typically we reach out to either the director of the library or the outreach person. there you go. There's the two things I mentioned in the chat box that worked out nicely. So the director is a good person to talk to because, as John says in the chat, they can refer you to who to talk to, and also the director may be the one making the decisions about who they work with and what programs they do. But if it is a really large library, or if you're having trouble getting a hold of the director and there is an outreach person, that is also someone that you can reach out to. Yeah, the directors do kind of like to know what's going on. So my recommendation would be to start with the director. If you can't get them or you don't know who they are and you can find the outreach librarian, that is another good person to reach out to. All right, here's another question. How do you handle the fact that medical marijuana is not legal federally? That is an important issue. The legality issue is something we will need to tread lightly around. If someone comes in and asks you about it, I would say you can direct them to that National Center for Complementary and Integrative Health, but I would, this is another great place for a disclaimer to remind people, you know, you're looking into this, but you're in a state where you can't actually use it. So that might be a good place to add that disclaimer, especially since the person may honestly not know. If you do have a question about something that is questionable legality, again, it's probably something that's addressed in your employee handbook at your library about how to deal with that situation, but I would certainly include a disclaimer if there's an issue for that. Absolutely. All right, well, if there are no more questions right now, hopefully I was able to answer that question well enough about the medical marijuana, but if there are other questions, you can feel free to email me. I'm going to go ahead and stop the recording here so we can do our final housekeeping and let everyone get out on time. So thank you so much. Oh, I do want to answer this one last question. If a student wanted to work with the NLM, yes. So there are a number of resources for students, certainly K through 12 students. There's also an NLM fellowship program. I believe it's specifically for library students, but that is a possible program they could apply for. Let me tell you to reach out to the K through 12 expert in our office. That would be Debbie Montenegro. She's been the one who's been tech support today. She'll be teaching a class later this year about K through 12 resources. So if you're talking specifically about those level students, that would be a great resource. And I'm going to go ahead and finish up. These are great questions. I wish I could answer all of them, but in the nature of time, I'm going to go ahead and end the session today. So I'm going to go ahead and stop the recording. Please hang around for just a few more minutes as we do our final housekeeping.